Hello, everyone. Welcome to class. Dr. Hess here with chapter 10. We're going to be talking about neurodevelopment and neurocognitive disorders. And let me pull up our lecture notes here. There we go. So some of the disorders in this chapter may be very familiar to some of you. We have the attention deficit hyperactivity disorder, ADHD or ADD, autism spectrum disorder, and some of the intellectual disability disorders, a lot of the learning and communication and motor disorders, and some of the more neurocognitive disorders, major and minor, and delirium. So let's go right here. Some of them, the neurocognitive disorders arrive in early childhood, and some of them will be seen more often in our senior years. ADHD or ADD is a learning cognitive disorder, which people have trouble concentrating. We now have some pretty good medications for treatment of these, but it's oftentimes hard to concentrate, hard to stay on task for people who are suffering from this disorder. There are other treatments, not just medication, but other treatments that are available, biofeedback and some behavior therapies have been found to be very helpful. Let's see. Autism spectrum disorder. These are symptoms include lack of appropriate social interactions and communication, trouble with communication, difficulty understanding nonverbal communication, in other words, body language or emotions and others. There's a theory that the mirror neurons are experiencing some kind of a dysfunction in the person who has autism. And oftentimes people on the autism spectrum will do self-stimulation or self-stim behaviors, repetitive movements, and depending on where they are on the spectrum, some of these can be injurious to themselves, such as headbanging or different hitting different parts of our body against the wall or a desk. Let's see here. Some of the theories on treatments, the selective serotonin reuptake inhibitors, the Prozacs class of antidepressants seem to be helpful in reducing the repetitive behaviors and reducing some of the symptoms. And of course, there's a lot of psychosocial therapies, behavior techniques. A lot of times, again, depending on the severity of the autism, a one-on-one therapist is needed throughout the day to help the child learn different ways of being in the world so that they can interact, go to school, do what kids need to do. Intellectual disability is people who are having trouble in a lot of different settings, being able to think correctly, learn, make new memories, and having trouble oftentimes in a lot of different of the domains, social work, and can be found as either mild, moderate, severe, or profound. This is the old, what we used to call mental retardation. So now it's intellectual disabilities. Lots of different reasons why this happens, including brain dysfunction and different developmental issues that happens. There's lots of different specific learning disorders that are in the DSM, reading, writing, math problems. And so if you're interested in those, they're all there. Help yourself to that. We have people who have trouble with language and speech, and lots of different reasons for this to happen, genetic and environmental. Some heavy metals like lead can cause some of these learning disabilities. We found over time lead that was in the environment and in the paint. Motor disorders, Tourette's probably being the most commonly known, has a persistent motor or tic that occurs in people that are living with Tourette's syndrome. And I think I do that. Let's go to the neurocognitive. So some thinking disorders. Dementia is probably the biggest category, including things like Alzheimer's and that kind of thing. These are these neurocognitive disorders cause problems in the attention and making new memories and daily functioning and emotional functioning, and can cause problems with people interacting in new situations. People can become very confused when they are experiencing dementia. Dementia is something that is usually associated with older age, and this is this decline in our cognitive abilities. Here's the different types of deficits. Sorry, I didn't mean to go so fast through that. Alzheimer's is common nowadays. Is something most of us have know someone or have someone in our family who is suffering from Alzheimer's. It is a clear decline in learning and memory. It is a brain disease that is fatal, and over the time of this actually Alzheimer's will end your life if you are suffering from that. Different reasons why we think Alzheimer's causes this. The tangles and plaques is the two things that I have a video explaining this in our content section of this chapter. So take a look at that. As far as we can know, we have no little blood test right now or anything that we can do to actually test for Alzheimer's. And so we have to go off of symptoms. The only way to really tell if someone has had Alzheimer's is to do an autopsy after they have passed away. And we can see in their brain the ravages of these plaques and tangles in their brain, which has caused them to have this form of dementia. Here's plaques and tangles and different brain images. Genetic problems with neurotransmitters are some of the common theories of this. We don't really know what is the common or the true cause of it yet. Soon we will know. Some of the other neurocognitive disorders are stroke, and this is where a blood vessel either is constricted or breaks within our brain, causing brain damage due to lack of oxygen that was carried in our blood. And so we have a neurocognitive disorder because brain damage due to that stroke. Also, traumatic brain injury, TBI, which is common in some of our professional sports, that repeated injury to our brain can cause dysfunction in that brain, causing neurocognitive disorders. Some of the treatments here, medical and behavioral therapists are used to help people learn how to deal with the lowered thinking abilities that come along with some of these things. Delirium is a little bit different than dementia. Delirium is a clouding of our attention. It oftentimes is associated with illicit use of drugs or too much of a prescribed medication. Sometimes we can have delirium if our electrolytes are imbalanced in our body, or we are in contact with some kind of toxic poison substance. Can cause memory loss, and is oftentimes agitation or anger in people who are normally not anxious or angry. Let's see here, and there we go. Okay, let's do that. Here we are. I'm back. You're back. Thank you for joining me on this quick little overview. Bye for now.